Today, I'm joined with the health officer for North Bergen, Union City, Weehawken, Secaucus, and Harrison, Janet Castro. Janet, thanks for giving me some time here. So obviously, Philadelphia, the governor, and tons of other officials are saying that we're in the second wave. So what are you seeing as far as safety precautionary measures, as far as, PPE testing and anything else in the towns that you're overseeing here?
So we have certainly increased capacity in all municipalities. We collaborate with our FQHCs. We have partnerships with urgent care, several urgent cares in the area as well. It seems like everybody is now overwhelmed, and we are seeing that lag in reporting that we did back in April and May. So we're doing the best we can to kind of, keep it under control again. But it's certainly, the trend is definitely in an upward direction.
So when did you start to see the trend going up, and when did you start to realize that, the second wave is either coming or will be here very shortly?
We always knew it was coming. It was just a matter of when. I think that we anticipated that it would start a bit later than it actually did, but we've been seeing the numbers rise. They started to creep up in October. About a month ago, we started to see a very slow rise. And then in the last 2 weeks, it's been exponential. We're back to where we started. I think that the biggest challenge in this, John, this time around, we're seeing similar numbers, right? Our daily case count is very similar to what it was in April. But the biggest challenge now is that everything is open, right? We've got businesses open. We have, schools, some districts are allowing the remote, some hybrid settings. So, businesses, it's not back. So we're not back to business as usual. However, we have resumed business to some degree, where in April we were under a complete shutdown. So that is the reason why we now have a whole lot more cases, and it's a little bit more challenging to control. A lot more contact tracing now, So I think that just makes it this time around a lot more challenging. People are out and about.
So with that said, it seems like the governor is slowly inching towards a second shutdown. Obviously he hasn't quite said that, but if you read the tea leaves, it seems like that's where we're going. So what's your opinion, and what's your knowledge, if you have any, about when this will come about again?
So I think that Thanksgiving, what we're going to see is we are most likely going to see a rise in cases after the holidays. It's almost inevitable, although he has already put some policies in place. I think that family gatherings, some people will be a bit more cautious than others, and it's inevitable. So I think right after the holidays, back to your original question, I think we're going to see that probably sometime in January. Listen, and it's pretty unpredictable, but that's what I'm assuming, because that's when we're going to. The cases are rising steadily now. I can't even imagine what it will be. Another month and a half from now.
So, the trend seems to be going, a step-by-step approach, trying to give the businesses every chance they can to collect the revenues they lost earlier in the year, right? And also to let people live their lives as much as they can, given the circumstances. But another topic that comes up a lot is the schools. Obviously, you have some oversight there as well. So do you feel like that might be something where we switch to an all remote learning plan before we get to another shutdown, or how do you see that playing out?
I think that might happen a bit before the governor implements his orders. The reason for that is we tend to see a lot of staff essentially just getting sick, and it's inevitable that once we bring in the children, that will only get more complex. That dynamic will be more complex. I must say that we have some amazing plans in place, right? We have great collaboration with the school nurses, with the school administrators, and thus far we have amazing partnerships where they get cases. We're all on the same page, basically. So if they eventually open up, they're well versed in what needs to be done. But I just don't even think that we're going to get there, truthfully. Because of the exponential increase at this point in time.
Gotcha. What do you recommend for Thanksgiving? We've seen some public officials come out and say that, just stay with your nuclear family. Others have been a little more vague, but it seems like everybody is saying that the time where you could meet up with 20, 30 people seems to be over and unfortunately in the rear view. So, what would be your advice to anyone as they're planning for the upcoming holiday?
So listen, I think as devastating as it sounds, and it's been tough. It's been tough, especially for our elderly population. You know, a lot of lonely individuals at this point in time, you know, that have been separated from their families. But, you know, removing the emotion out of that, the best advice is to try to isolate yourself, or just stick to your nuclear family, as you mentioned, because to have the extended family, that, you know, the larger the group, the higher the exposure, the higher the risk of exposure. And at this point, it's those people who are most vulnerable, you know. And although we're not seeing that increase in deaths, John, thankfully, because we're better able to treat the virus, and you know, we're more knowledgeable, you know, thankfully, you know, science has provided a lot of knowledge for us. But I think that people are still getting sick. So people aren't dying, but they're still getting sick, and there's still that risk of, you know, of complications due to COVID. So I think that, yeah, the best advice is certainly to definitely keep that group as small as possible for the holidays.
All right. So look, obviously that's not the news people want to hear for the most part, but you know, obviously you want to give prudent information. So obviously we want to get past this as soon as possible, and we've seen now two vaccines have very successful trials, and it's looking like the mass release, the mass production will be in approximately April. So, you know, I don't know if you could provide any other particular details on that, but I'm sure people are curious to know with what's going on with the vaccine.
So the vaccine program, actually, we've received a much more favorable date. You said April. We are anticipating actually receiving shipments as early as late December, to begin distributing as early as January, mid to late January, you know, to get the vaccine.
Like, mass population?
So no, we're going to start in phases, right? You know, so there are different phases that we need to implement. When we administer these vaccines, we need to prioritize them. Healthcare workers, essential workers, immunocompromised elderly population, and then it will be the general population. So now children are not part of that general population just yet, just because the risk of COVID in children is still relatively small. So the ambitious goal, it's going to be a challenging program, but the plan includes vaccinating 70% of our population, of our communities, within 6 months' time. So it's quite an ambitious number, you know. But we're getting ready for it, and we're trusting that, you know, the state will provide us with plenty of guidance to get that done. You know, and then we need buy-in from our communities, right? From our elected officials, which, you know, at least around in my municipalities, they're all on board, you know, with assisting to set up these dispensing sites. And that's it. We move on from there, and partner with as many facilities as we possibly can to get the vaccine out there. You know, we've heard some really positive news, you know, that, you know, the vaccines are 90 to 95% effective. So that is much better than we anticipated, much better than the flu vaccine.
Right. So ideally, like as now we're seeing the testing sites, that is from the government side, and also, you know, we'll see at the CVS. So it would transition then to where those same sort of things would just pop up and be vaccination sites, right? I mean, in an ideal world.
Yeah. So that's listen, those are, so what's happening is the pharmacies are able to partner to create partnerships, right, with the state and the feds to receive these allotment of vaccines. So they will also, so the vaccine will be distributed to providers and to facilities that apply to become partners. So they, in essence, can become independent sites for their population. And the pharmacies will be able to receive the vaccines as well. Just as they do the flu vaccines, they will also be able to provide it. So thankfully, it won't just fall on the heads of the health department, the local health departments, to get this out to the community.
Just where did you see the numbers start to spike the most, the soonest, and why do you think that was the case?
So, okay, so North Bergen and Union City, certainly. I think North Bergen and Union City, first because the demographics of our population, we're the most densely populated, at least in North Hudson. Union City has always, unfortunately, taken the lead with the numbers. and North Bergen, a very close second. At least in our North Hudson. Jersey City is number one in the county, obviously based on population. But so for the most part, we have our population consists of quite a number of long-term care facilities. So our long-term care facilities, we're starting to see some cases. It's not anywhere near where it was back in April, but I am seeing some cases back in the long-term care facilities again. The schools, so as far as if I see any hot spots, that's where I would attribute it to the long-term care facilities and the schools, the daycares as well.
Okay. Oh, and actually one more. So for people that are interested in getting daily, bi-daily, weekly numbers out of their municipality, where would you recommend that they look in terms of just where are the COVID numbers, the recoveries, where they could go get testing, and when it's time to get the vaccine, what do you think is the best places to go online?
So the town websites, each municipality has their own, they have a daily count. So I provide daily counts to all of my municipalities. But the county also has, the county Department of Health website also has a COVID data dashboard that provides the numbers. It has, some amazing surveillance information on there as well. So either each individual town or the county Department of Health website.
All right. And then just, is there anything else that you wanted to add that we didn't touch on perhaps?
You know what, when you asked me before, as far as the towns that were hardest hit, I also wanted to mention that the Department of Health also came in because Harrison was a hot spot for a little while. We started to see an alarming trend in Harrison, and we really couldn't pinpoint it to any one location. We just saw a slight increase, abnormal to the trend that they had all summer. And the state recently came in and set up a COVID team as well over there. So that's really been helpful. I believe that they also provided resources to North Hudson for Union City to ramp that their already existing site over there. But I just wanted to add that the state, has also collaborated. They're keeping an eye on our numbers, and they did recognize that Hudson County, is struggling with that. So, and we're still looking to expand some sites. We're looking to to provide, more PCR testing, antibody testing, if somebody wants to try to figure out if they had the virus at one point or not. But, we're doing the best we can with the resources and control what we can control. Oftentimes these labs, are at capacity, and now we're back to, they're not able to produce the reports in a timely manner, which is expected, right? When you've got this surge. Our urgent cares are now, you've got lines, hours, I'm hearing. So it's definitely, we're just, trying to do the best we can and expand capacity partnerships with other facilities as well.
All right. Thanks so much, Janet. Certainly we appreciate this time, and definitely stay safe.
Thank you. Thank you, John. Thanks for having me.